Hi guys, and welcome to Diabetes. In this video, we're going to learn exactly what is diabetes and how to help our patient in case of a diabetic emergency. I hope you are excited, and let's dive in. Okay, so to understand exactly what is diabetes, I think we should probably talk a little bit about the anatomy of our body. Humans, they need to breathe, to drink, to eat, and to sleep to survive. We all know this. And I want us to talk a little bit more about to eat. The reason why we eat is because it helps us fuel our body. When we eat, we're basically getting energy from food, and that energy goes inside of our cells, and that way they can function and they can reproduce and continue to work. Now, one of those fuels is glucose. Glucose, in other words, is basically sugar. We get sugar from a bunch of different foods, if it's carbs or if it's from plain sugar, but actually we don't need to eat sugar to get sugar. We get it from a lot of different foods. And what's interesting about glucose is that our brain cells, the cells inside of our brain, can only take glucose as the fuel that is fueling the brain cells. Now, the interesting part about glucose is that after we eat food, obviously it runs inside of our blood. But the thing is, for glucose to manage to escape our bloodstream and enter the cells inside of our brain and inside of our body needs to produce a hormone that is called insulin. Basically, you can think about insulin as the key that lets glucose enter our cells. Now, the way that diabetes work is that, it depends on the patient. There are two types of diabetes, but in some situations, some patients can't produce insulin at all or very, very, very little. So basically, you can think about it as they don't have the key to let sugar go inside of their cells. And we also have type 2 diabetes, which means that patients can produce insulin, but it's not enough, or they can't really absorb the insulin as well as they should. So these are the two types of diabetes. The first one is when they don't have a key, and the second one is when they have a broken key or not an effective key. Now, it's important to note that patients who have type 1 diabetes, or in other words, patients who don't really have the key, which is the insulin, they must receive insulin shots. Now, this type of diabetes is a lot less common. Only about 5 to 10% of people have it. It is usually found out in a very young age because people usually are born with this type of diabetes, which is also why it's called juvenile diabetes, and it is typically considered more severe or more serious than type 2 diabetes. Now, unlike type 1 diabetes, type 2 diabetes is something that gets developed with time if the patient has a bad diet, not a proper diet. So this is something that is usually more common the older people get. And people who have type 2 diabetes, they usually need to really focus and monitor after their own diet. And they usually don't need to get any insulin injections in most cases. They just take medications. However, if people have type 2 diabetes and after some time, their body can become even more resistant, and it might even stop producing insulin as well, which basically means that they will need to receive insulin injections as well in some situations. So for us, it's important just to remember that type 1 diabetes always get insulin shots, and type 2 diabetes usually don't, but sometimes they do. And it is important to remember this for us because most people, we need to understand this, most people don't need these injections. Okay, now it's time to talk about the diabetic emergencies. Now, there are two diabetic emergencies that we should be aware of. And the first one is when our patient have too much sugar in their blood. Or in other words, it is also called hyperglycemia. Now, what is interesting about hyperglycemia is that Usually the reason why they have too much glucose, too much sugar in their blood is because they don't have enough insulin. Now, this can happen actually from quite a lot of reasons. If it's type 1 diabetes, then it can happen because they didn't take their insulin shots. Or type 2 diabetes, it usually will happen if they ate too much sweet things, because their body can't really produce enough insulin to cope with that amount of sweet things. That is actually an emergency that we should take care of. Now, patients who have hyperglycemia may show signs of thirst and dry mouth, tummy ache and vomiting, restlessness and confusion, fast and weak pulse, red and dry skin, and most iconically, they might have a fruity smell from their breath. If this is untreated, then it can develop to something more serious, where the main dangers are life-threatening dehydration and having a coma. Now, it's important to note, patients who have hyperglycemia usually show signs that are very, very similar to dehydration. Now, the reason for that is because the body can't really produce enough insulin to get the glucose inside of the cells, it is trying to get rid of it. So we can also see our patients going very often to the bathroom and having a very, very dark urine and things like that. Because again, the body is trying to reduce that insulin and it can become life-threatening. Now, the way we treat hyperglycemia is fairly simple. We need first of all to recognize that this is what is happening. We need to call for help, and if we have an insulin shot, for example, some patients they have insulin shots in the freezer just in case in emergencies. If we can find some sort of insulin shot, then we should tell our patient to administer it on himself. And lastly, we want to wait for the ambulance to arrive. Basically, the most important part in this treatment is to recognize that this is happening and making sure that our patient gets to the hospital if he has no insulin shot. Okay, now for the second diabetes emergency, which is hypoglycemia, which means our patient have too little sugar in his blood. Now, this one is probably even more dangerous than hyperglycemia because if our patient has absolutely no sugar in his blood, that means that the brain can't really get the fuel that it needs. Now, this usually can happen from two different ways. If it's a type 1 diabetes patient, then it might happen because he took too much insulin and now he doesn't have enough sugar in the blood. And type 2 diabetes patient, it can usually happen if he skips a meal or two. Okay, now for the signs. The signs of hypoglycemia include headache and dizziness, strong hunger, becoming easily irritated, moody, tearful, or anxious, basically changes in the mood, turning pale, having a fast pulse, and sweating. And also, in some cases that are a bit more severe, our patient can have blurred vision. Now, the main dangers of hypoglycemia is that if it is left untreated, it can lead to a loss of consciousness, to a seizure, and eventually to death. Okay, now for the treatment. Now, the treatment for hypoglycemia is also pretty straightforward. The first thing that we want to do is, if we recognize that this is happening, we should first of all call for help. The second thing we want to do is we want to give our patient, if he is conscious, something that is sweet to eat or to drink. So it can be an energy bar, it can be some candy, it can also be some juice, a non-diet soda. We can even just give him a glass of water with some sugar inside blended. Those are the things we should give our patient if we recognize that this is what is happening. If he is unconscious, then in that case, it is usually recommended we would not give him anything because he might suffocate. So this is what we want to do, and we want to make sure that we wait for the ambulance to arrive, and that is basically our treatment. Now, it is important to note that if we are unsure if our patient is having hyperglycemia or hyperglycemia, we're not sure if he has too much sugar or not enough, in that case, we should actually treat it as if he doesn't have enough sugar, and we would want to give him something sweet to drink or to eat. And the reason for that is because hypoglycemia is more dangerous than hyper. So we want to make sure that the treatment is that we call for help, we give him something sweet to drink or to eat, and we wait for the ambulance to arrive. Cool, and that is it for this video. You guys now know what is diabetes, you know a bit about the anatomy of it. I hope this video wasn't too complicated and that you did have fun learning all of these things. And that's it. I'll see you in the next one, guys. Bye.